Welcome everyone to Precision Nanosystems Teatime Webinar Series. I'm AJ Johnny of Precision Nanosystems here in Europe, and thank you all for attending. So this is a Teatime Webinar Series that we've started on a Wednesday, every other Wednesday, and it will be about half an hour long, just to give everybody an opportunity to interact with each other and a chance to present your work. So if you feel like you'd like to use this opportunity in the future, please feel free to contact us and we can give you a slot to present. So for our first meeting, we've got Professor Yvonne Perrie from University of Strathclyde, and she'll be presenting on the translation of production of nanomedicines from the bench to GMP production. Also, I thought I'd just mention, many of you may have seen the adverts on our website and on our social media, that we do have a webinar tomorrow at 3:30 Greenwich Mean Time and 4:30 Central European Time, hosted by Andy Gill and Lloyd Jeffs, and they'll be discussing the development of RNA medicines for the treatment of pandemics. So what I'd like to do now is hand it over to Professor Yvonne Perrie from University of Strathclyde. So over to you, Yvonne. Thank you.
Okay, great. Let me just get my slide share going. Okay, right. So thanks for everybody who's dialed in. I hope everybody's staying safe and as happy as they can be. That photo AJ put up of me looks a bit like the before and after of lockdown, but hopefully everybody else is doing a bit better. So today I thought I'd give you a bit of background on how we've been translating the production of nanomedicines from bench to GMP production. So as we know, nanomedicines, they are great. They offer lots of evidence of how effective they are in improving drug delivery, improving potency. But we do see challenges in the scalable manufacture of them. They do present some issues because they are much more complex in manufacture and they are a newer product. But this does apply to the older products as well. Even back to the production of calyx, we did have problems back in 2013 where we had issues with manufacture. So we really do need to address this challenge of improving manufacture. That was really where the ethos of a lot of the work we've been doing in our lab has come from, particularly when we moved up to the University of Strathclyde, who have a very strong focus on manufacture and translation. So, as I say, lots of research about nanomedicines, how effective they are, and we can do it. So we can do lots and lots of research in the lab, but there's more to it than that, and we don't just want to be stuck doing lab work. We want to know we can get our data from the bench into basically the clinic so patients can actually benefit from this work. And we know it's doable, but we want to make it easier, quicker, and basically de-risk this process, as is often said. So we need a line of sight. So manufacturing and microfluidics has been looked at very seriously in a lot of labs now. We're all starting to consider it. There is a wide range of options. So most of us have been using the staggered herringbone if we've been using the precision systems, but there is also the T-mixer, hydrodynamic flow. You can see here the options here. And if you look at A, the toroidal mixer, that is a new system that's been brought out by Precision, and we've been looking at that system. But in all of them, you're basically looking at mixing an aqueous with a non-aqueous environment, and due to that, you get nanoprecipitation, and out come your nanomedicines. So generally, we've focused on the use of liposomes. So liposomes and lipid nanoparticles, the debate whether they're similar or not, I won't go into, but we can make liposomes negatively charged, neutral, or indeed cationic. And in all the formulations, we can use them to deliver drugs. We can also use them to deliver subunit antigens, and commonly cationic formulations are used to deliver subunit antigens and nucleic acid systems, including RNA, with a lot of the LNPs with the lipid nanoparticles. And there may be some restructuring involved with these cationic formulations with a more dense core and less aqueous environment. But you can see the structural attributes are very similar across them. And what I have put on these slides, because I know they'll be shared later, is the link to any of the data that we've used. So for example, The lipid nanoparticle work is in Gustavo's thesis, which has been published. He passed in January. So when we consider scaling up, how do we get from the work we do in the lab, knowing that other people will be able to manufacture this, or indeed we may want to? So we had been working with a staggered herringbone mixer that most of us have used with precision systems, and we know the flow rate and flow capacity is generally between 1 and 20 mils with a nano assembler, and the Blaze does scale it up. But recently there was a development of a higher flow rate capacity cartridge, so the toroidal mixer, which is shown in green at the bottom. The advantages of that, it can go up to 20 litres per hour, and that's through the design. It's much easier to scale up in various aspects. So Precision would give more details on that. I wasn't involved, obviously, in that aspect. We've just developed in our systems, our nanomedicines, using their cartridges. So this is some of the data we worked on, because originally we'd done all our work with a staggered herringbone mixer, and we wanted to check that it mapped onto the new design mixer. And the new design mixer allows us to then scale up to GMP. So what you can see here in graph A, we have the light grey is made with the staggered herringbone mixer, and the dark grey is the new toroidal mixer, which you get in the Ignite system. So you can, if you compare the light grey and the dark grey, we have negatively charged liposomes, neutral charged liposomes, and cationic. So the top graph shows us the size was reproducible, mapped across the three formulations using the two different mixers. Below in graph B, we have the loading. So for the negative and neutral formulations, this is protein just over. We've loaded in this for convenience. And you can see again, the loading does map. Generally, loading is lower with the negatively charged liposomes. Our neutral ones give about 30% loading with protein. Our negative gives about 20%. With the cationic, we actually loaded poly-A, which is a surrogate we were using for nucleic acid. So obviously you get something very positive charged with the cationic liposomes, and when you do a one-step mixing process, you get high loading, 100%, as we see with all LNP formulations. So you can see it maps nicely between the old mixer and the new mixer that was brought out that gives higher capacity. So also just checked in terms of architecture, so the liposomes have similar round structures as we expect. We didn't see any loss of lipid before and after, so we tested how much lipid we put in the system and how much came out after production, and that mapped to 100%. And we also measured protein release. So graph D, you can see that we mapped release over time for protein over again entrapped in neutral liposomes prepared through the two different mixers. And again, we get good reproducibility. And again, I must say all the links are at the bottom of these slides. So this was work that just, it's in press, but it was accepted for publication in 2020. So just earlier, last month, I think. So you can see that's how we start. So we mapped over to the new mixer. We would have in-process controls that we would monitor. So particle size, as we would imagine, is one of the key quality attributes of a nanomedicine. Polydispersity important. Zeta potential, we see, very important, and lipid recovery if you've got a complex formulation. You don't want to be losing cholesterol, for example, because you could have different release rates. You don't want to lose your cationic lipid, it might change loading. In terms of washing, so we would use TFF to remove any residual solvent, and we would test for that using GC or other methods, check drug loading and the various attributes again. And finally, you would go for quality control attributes, so you would sign off on all that. So this is the setup we use, microfluidics followed by TFF. So this is us, so you can see this is the first graph A. You've got the scale up from GMP, so we started at 12 mins per minute and we go up to 200 millilitres per minute, and that's in the graph going left from right. So you've got total flow rate on the x-axis, on the y on the left you've got the size, and you can see here the grey, and then the PDI, the scales on the right, and it's the open circle. So you can see no change as we go from 12 millilitres per minute, which we were doing in our lab, the larger scale, which we did in the Blaze in our lab, through to 200 millilitres per minute, which we did out in the PNI site in Vancouver on their GMP system. So nicely mapped across from what we were doing in the lab straight onto the larger system without any further development. So you can basically set up your protocols as you would in your lab, and you know it transfers over. In terms of intensity plots, again, very nice intensity, same polydispersity, same particle size. And in terms of protein loading, so again, we used a neutral formulation, liposomes incorporating protein. We always produce it at room temperature, even though they are high transition temperature lipid. You can do that with this formulation and this production system. And you see protein loading is around 20 to 30% across all platforms. So the Ignite, the small lab scale, the Blaze, which is preclinical, and then GMP production. So nicely mapping across all three. So when we've been developing it, we have been looking at process parameters to consider, and some that are less obvious, that which we discovered, and this again has been published recently, is actually the buffer that you use in terms of like TRIS and PBS actually also has an impact. So this, we did some studies with a cationic formulation. Again, the publication's down the bottom of that. Gustavo Liu and the team from our lab did it. And basically you get a lipid mix, and then you get TRIS buffer, normal TRIS buffer. If you go with that and cationic formulations, this is a DOTAP-based formulation, the liposomes are about 40 nanometers in size. If you use a high concentration TRIS buffer, so around, it was scaled up and you can scale it across. So you start with high concentration TRIS, you get very large liposomes, they're about 500 nanometers. You can then wash and get it back down to the normal concentration of TRIS, but you still retain these large unilamellar vesicles. So that's great if you want very large vesicles, but also shows you it's important to consider your buffer choice when you make liposomes, because it does have an impact. Equally, the solvent you use can have an impact. Obviously, lipid solubility is one of your key parameters. You're always going to be thinking and checking that you have the appropriate solubility, but it also does have other factors. So we know flow rate ratio, the rate we mix lipid phase versus aqueous phase, has an impact. We've seen that in many publications, and generally as you increase your flow rate ratio, you decrease your particle size. And it's generally to do with, as we change the polarity, we cause nanoprecipitation. So the quicker we can change that polarity and cause a precipitation, the smaller the vesicles we get. Well, that's our hypothesis. So it'd be great if anybody has any more thoughts on that. So you're changing this polarity. Out come your liposomes. The quicker you change it, the smaller the vesicles, because it's less time to form. So if you use different solvents, here we've got methanol, ethanol, and IPA. So the vesicles actually get larger in size as we go across, because basically with the other lipids, it takes longer to change the polarity and you get different vesicle sizes. And actually, if you look at the graph C, that's us mixing methanol and IPA. So we're controlling that solvent polarity, and actually we can control the vesicle size between about 50 nanometers up to, it was about 100 nanometers, all with a very low PDI, about 0.2. And again, it's monodisperse, it's not mixtures. So another way you can actually control your vesicle size through that, or if you're looking at using solvent mix to improve solubility of lipid, consider that may have an impact if you change it on your particle size. So really, those are the parameters. There are other ones, obviously lipid concentration come into, and flow rate can have an impact, but as solvent sensitive and product sensitive, we tend to see less impact on our liposome formulations, but we have seen it with other systems like PLJ and nanoparticles. But we know how to manufacture now, so that's great. So we now have a template, we know how we would scale up, so we can actually now focus on making these more interesting formulations with liposomes, because we have a route to manufacture now. So a couple of formulations we've been looking at are negatively charged formulations for lymphatic targeting and cationic ones for vaccine delivery, which we've done a lot on. So just to pull out a couple of those. So in terms of, delivery and targeting strategies, we've been looking at delivering to the lymphatics for two reasons: may improve vaccine efficacy, but also that can be a site for enhanced drug delivery if you're looking for targeting the lymphatics, for example, anti-cancer agents. So if you do an IM injection with liposomes all the same size but different charge, what you see is a different depot effect. So if we make liposomes neutral, anionic or cationic, all about 100 nanometers, we inject them IM, then the cationics stay at the injection site, form an aggregate in a depot, whereas the neutral and negative, shown here in red and white circles, drain away quickly. And then those that drain away appear at the local lymph node, whereas the cationics get stuck at the injection site and tend not to move. So that's great if you want a depot, the cations, say you want to get to the lymphatics. So we've been looking at using anionics to achieve that, and we've added in targeting. So what you can do is you can basically use Biotin Avidin as a complexing agent. So you put the biotin on your liposomes, it'll cross-complex with Avidin and give you an aggregate. So what you do is you pre-dose with Avidin. The Avidin then drains to the lymph node. You then inject your liposomes with the biotin 30 minutes later. They then pass through the lymph node, but when they come in contact with Avidin, they cross-link and get stuck at the lymph node. But that was the theory, so we tested that. So we made 2 liposome formulations with microfluidics, a negatively charged one, and the same formulation with a biotin on the surface of it. So again, the publication is down the bottom, so this came out late last year. So what you can see here is us tracking both the liposome, shown in black triangles, and the protein that was entrapped inside them is the open circles again. So this is 2 liposome formulations. So the top one, DSPC cholesterol PS, has no targeting, and the bottom one has the biotin, so we'll be able to cross-link. So after injection, they both flow away from the injection site the same rate as would be expected. However, when we start to look at the draining lymph nodes is where we start to see a difference. So you can see that the negatively charged liposomes on their own do appear at the popliteal lymph node, as we knew, take the protein with them. But when we get biotin, they do hold the liposomes there longer. So if you look at the bottom graph with the black triangles, the liposomes are sitting at the injection site longer. But more interestingly, you actually see it spreading to other lymph nodes. So when they're just negatively charged, they only make it to the popliteal, they tend not to get further. But when we use the biotin targeting group, you see that the liposomes move to other distant lymph nodes, taking the protein with them, as you can see, and giving us that delivery to more distal lymph nodes. So we did look at immune responses, and we didn't see any difference between targeting and non-targeting. So that's quite good in terms of if you want to use it for drug delivery, because you can actually enhance drug delivery without creating an immune response to the loaded protein. So that would be useful. In terms of vaccine delivery, we saw no advantage in this enhanced targeting. So looking at the other end of it, the cationic formulations, we've been using them as adjuvants. So this is a paper that's just come out. I think it was posted today by JCR editors on Twitter. So the link's there, it's free for 50 days, so be sure and have a look at it. So this came through one of our EU projects, Fast Train VAC, where DESPO, the first author on the paper, was conjugating a protein to a CPG motif to enhance its immunogenicity. So delivering them together is a good thing. But what we did was we further boosted it by using a cationic formulation, which is shown as DSPC, distereophosphatidylcholine, cholesterol, and DDA, dimethylammonium bromide, which is a very potent immunostimulator as well. So we made the liposomes as we would normally do with microfluidics. We then tested a range of combinations. So we have the protein on its own, protein conjugate, as you can see, or a mixture, and then again these 3 combinations with liposomes. And as I say, the protein was basically group B strep GBS protein with the CPG motif added on to it. So this is an example data. I'm not going through it all, but there is all there in the paper. It looks really nice. But what you can see going from left to right is this is IgG total shown in the graph. Pre-immunization, it's low. The protein on its own is low. When you conjugate it to CPG, it does boost the response. When you just mix them together, it doesn't make any difference. It's basically because they flow away very quickly and don't act together. When you just have the protein with the liposomes, you do get an enhanced response, as we would expect. It's immunogenic. But when you have all together, the protein with the conjugate and the liposome, you get the best immune response. You can also combine them together without the conjugate. You get a good response, but the whole thing together gave us the best response. And as I say, this graph is for IgG total, but it was very similar for IgG1, 2A. The antibodies were confirmed as functional. So that was done by the GSK team. They led on the in vivo studies. And it was a similar story with all the cytokines tested. And interestingly, we also looked at the biodistribution. So this was done at Strathclyde. So again, what we have here is the protein. Now label the protein with a fluorescent probe, Elexfluor 790, you can see here, and the mice depot formation is tested over time. So top row control is actually just one mouse, but we use it as a reference point, so it had no injection. And then the second row is the protein with a label on it over time. So you can see the intensity of the colour slowly disappears as the free protein is cleared. And that is also shown in graph B with the blue line. So that's protein moving away from the injection site. When the protein is conjugated to the CpG, again, it's a very similar trend. It moves away from the injection site. And if you look at graph B, that's the orange line with the protein conjugate moving away. The third row of fluorescently labelled mice is us still tracking the protein with the conjugate, but now absorbed to a liposome. So you can see it's held at the injection site for much longer. So you can see that by the colouring. And also, if you look at graph B, the grey line is showing us the protein sitting at the injection site for much longer. And then if you look at the last row of mice with the fluorescence, so that's where we've now fluorescently labelled the liposome as well. And we now track that, and you can see the liposomes sitting at the injection site. If you see graph C on that one, you see the liposomes sitting at the injection site. So they're sitting there holding the antigen to all at the injection site. And what we believe is happening, this creates a danger signal. You get invasion of antigen presenting cells and you get this improved immune response. So overall, in summary, what we now have hopefully shown you in this and given you some references with more details on it, is we all know that nanomedicines are great for protecting drug and antigen. They're great for improving delivery and they improve potency, there's no denying that. But we had a problem with how we're going to manufacture, but microfluidics is clearly a nice solution for that. There is also other solutions, but microfluidics is responsive, meaning we can scale up and down rapidly without having to change process parameters. It's reproducible. We get lovely small PDI and it scales across all the platforms. And as I say, it's scale independent. You can produce 1 mil when you're short on API, but then you can scale up once you have it. And just acknowledge, obviously, this is a very large scale work with lots of people involved. So we have a list of all the people who helped in our lab, but you can't also forget the guys from GSK and the others from all the other universities that have contributed to this work. So it's thanks to everybody in that. And that's us. So we'll open it up now for questions.
Thank you, Yvonne, for your presentation. They're very interesting data. I think one thing I found quite interesting was how the concentration of the buffer affects the particle size, and I don't think it's something that we talk about very often. And thanks to everyone for attending. Thanks, Martin, for the questions. Again, Martin is our European field application scientist based in Germany. We also have Richard Broadhead, who's our field application scientist based out of Oxford. And then we have Jürgen as well, who's our regional sales manager based out of Berlin, and myself, who's in London. So if you have any questions, you can come to us directly, and we can pass them on to Yvonne as well. Or if there's any other questions related to precision nanosystems, we can assist with that. And then we will be posting another webinar in 2 weeks' time on Wednesday, and I'm sure you'll see some adverts for that, so please feel free to attend. So thank you very much all for joining, and have a great afternoon. Bye-bye.